back with State Health and Human Services Secretary Dr. Mandy Cohen, and you can continue to text your questions. This question is, if more mass vaccination sites open, does that mean that counties will get more doses of the vaccine?
Yeah, so we know it's going to take multiple strategies to make sure we can keep getting this vaccine out quickly. And what we know is that our vaccine providers can probably get out 3 times the number of vaccines than they are actually getting in terms of supply. So there are a few places that are doing these more high throughput vaccinations. Others, we're trying to make sure that they're getting out to all of the communities across North Carolina. That's very important to the governor, to me, to make sure that we have access points in all of our 100 counties, as well as making sure that we are reaching underserved communities. So, and we know that mass vaccination events is not going to reach everyone. Not everyone has the ability to take off from work or to have a car and drive to those events. So we know we need a bunch of different strategies, and I'm grateful for our vaccine providers that are doing a bunch of different things to make sure folks have access to vaccine.
Well, let's kind of follow up with that. What about those underserved communities? How are we looking to serve them?
Yeah, there's a number of ways in which we are making sure that vaccine gets out equitably, while also making sure that we're keeping up that speed, right? We don't want vaccine to be on the shelf either. But we are making sure that we are allocating, as I said, to all 100 counties, and we're giving actually an increase in the amount of vaccine a county gets if it serves a larger portion of those who are 65 and up, who are low income, or 65 and up who come from the African American community, Latinx, Hispanic community. So we are trying to make sure that we are balancing for equity. We also are supporting those vaccine events, some of those higher throughput events that specifically target our underserved community. We've done that all over the state and are going to continue to do it. But it's really about local partnerships on the ground. We're trying to facilitate those partnerships, but it's really watching our vaccine providers partner with large African American churches or partner with community organizations that know their community and are trusted by their community. I think trust is so important, not just as we learn about the vaccine itself, but that there's a trusted site where you can go and get access to it. So those are the places that we're trying to support, those trusted places where folks can go get access to vaccine.
This text question says, does everyone get the same dosage of the vaccine?
Everyone gets the same dosage. Dose 1 and dose 2 are the same for both of these vaccines that are out, and everyone gets the same vaccine no matter where you are in the state.
Can you weigh in and tell us if we will need to get this vaccine every year like the flu shot?
It's a great question. I don't think we know that for sure, but I think we believe that we likely will need some sort of booster shot or a repeat vaccination similar to flu each year. And that's because the virus changes. We're already hearing about the virus changing somewhat and seeing new variants that are out there. I think we don't know yet how soon we will need a booster. Are we going to need it this fall? Do we think we can go a year? Our scientific community is going to continue to monitor that. But I do expect at some point that we will need a booster.
This person's asking, when I'm eating out, how safe is it to take my mask off to eat?
It's a great question. What we know is masks work. Masks protect you from having droplets come out of your mouth or your nose. So once that mask is off, there's more risk. So, we are really encouraging folks to really think about their own risk and what it means to go to a restaurant and have to take off your mask. I would not be doing any activities where you really can't wear your mask all the time. Get takeout from the restaurant, support your local restaurants. I do, but safer to be getting takeout and doing that at home, because again, being at a restaurant, you have to take off your mask. And again, that's the time where the risk really happens.
This person says, what kind of conversations are you having with the federal government to get more vaccines for our state?
Great question. And just this morning, the governor was on with governors from all across the country, was on with the Biden administration. All of the governors are advocating for more supply all the time. And Governor Cooper is also echoing that. He was sharing with the Biden team, again, that we can vaccinate 3 times as many people as the supply that we are getting. We want to get more supply as soon as it's available. So we are advocating to the federal government. Again, we're just limited by that manufacturing, but I'm hopeful with another vaccine that is going to be reviewed by the FDA in the next coming weeks. I'm hopeful by March we might see another vaccine here in North Carolina.
And we would all look forward to that. And someone very quickly said, I shouldn't have to pay to get a vaccine, right? No.
Correct, it's free.
Right, registration's free, the vaccine's free. Thank you, Dr. Cohen, for joining us. We so appreciate it, and we appreciate your time.
Thank you, everyone. Stay well. Remember to do your 3 W's. There's a lot of virus out there. Where we're all going to be patient while we wait for this vaccine. Make sure you're protecting yourselves and those you love. Thanks.